Hello, my name is Dr. Miguel Rodriguez. I am a gastroenterologist with Miami Gastroenterology Consultants in Miami, Florida. I thank you for visiting our site, and I'd like to provide some information about colon cancer. Colorectal cancer is one of the most frequent pathologies of the gastrointestinal tract in the United States, and it applies also to the rest of the world. Colorectal cancer has become a preventable disease as the years go by, and I'd like to inform you of how we can prevent or at least detect or provide early detection of colon cancer in the general population. As I indicated before, this is a lesion or a disease that initiates its progress with the appearance of what is called a colon polyp. A colon polyp can be compared with a small pimple in the colon, in the lining of the large intestine, that continues to grow, and eventually cells become malignant and cancer develops. We perform a procedure called a colonoscopy, which is the direct visualization of the inside of our large intestine in order to detect these polyps. These polyps can be removed at the time of the procedure. They are then analyzed, and we are able to provide a prognosis or a complete diagnosis of the condition. The incidence of polyps in the general population is around 1 in 60. They don't need to be malignant, but the type of polyps that derive from the lining, the glands that are in the lining of the colon, are the ones that have the potential to become cancer. Other types of polyp can occur due to inflammatory changes in the lining of the bowel, and they usually do not progress to cancer. Since we are not able to determine at the time of the colonoscopy what is the nature of the polyp, they are all removed and analyzed subsequently. Colonoscopy is a simple test which requires that the patient prepares him or herself to clean the bowel and allow a good visualization. It is done under sedation, and it takes approximately 15 to 20 minutes to obtain a good visualization of the whole colon. At that time, we are able to do biopsies, remove polyps, and get a good inspection of the entirety of the bowel. If the diagnosis of colon cancer is made, we follow an algorithm or follow a guidelines in order to determine if the cancer is localized or has a spread beyond the colon. Once the diagnosis of cancer has been made, usually the patient will undergo imaging studies such as a CAT scan or a PET scan to determine if the tumor or the cancer has a spread beyond the colon. Once this is accomplished, patients will either undergo surgery or will receive chemotherapy in addition to the surgery. This is a decision that is made in cooperation with surgeons and oncologists. Key to decrease the chances of having colon cancers is performing a colonoscopy beginning at age 50 and repeated at every 10 years until age 75. If we have family history, particularly first-degree relatives with colon cancer, the onset of a screening should be the age of 45 or 7 years from the age of detection of cancer in our relative. That will at least give us the opportunity to detect any potential lesions at the earlier stages. If you would like to have additional information, please visit our website at www.miamigastro.com.